My name is Katy Scheiding, and I'm a nurse practitioner in the Department of Obstetrics and Gynecology at Christie Clinic. We're going to talk about the virus HPV today, as it is associated with cervical cancer. The two leading HPV viruses that are associated with cervical cancer are HPV 16 and HPV 18. There are vaccines available for these viruses to help prevent these viruses from ever causing cervical cancer. So when we do a Pap smear and we obtain cells from the cervix, we have started over the age of 30 or younger if a Pap smear is abnormal, also running an HPV test to see if there's an increased risk of a person having cervical cancer. So when we're looking at the cells, or the pathologist is looking at the cells under the microscope, we're looking to see, are all of the cells normal and consistent, or do we have changes that may increase the patient's risk for having a dysplasia or a cervical cancer. Now, when we have an abnormal Pap smear return, we may just follow the Pap smear up in a certain length of time, maybe 6 months or 12 months. The patient may be recommended to have a procedure called a colposcopy, which is typically done in an office exam room where a solution is applied to the cervix so that we can look at the cervix a little closer with a microscope and then take biopsies if warranted to make sure that the cervical tissue is healthy. Results of that typically come back within the next few weeks, and then the patient may have follow-up Pap smears recommended or may proceed to further procedures to try to take care of this virus. Some signs and symptoms I'd like for you to watch for would be any abnormal vaginal discharge, any bleeding or pain with intercourse or after vaginal sex would be a reason to let us know. If you have any pelvic pain with intercourse or pelvic pain that you don't feel can be explained otherwise, that would be a reason to let us know that might warrant evaluation. If you're needing evaluation or if you have any women's healthcare concern, we'd like for you to give us a call at 217-366-1255 to schedule to meet with a healthcare provider. Thank you.